Hi everybody, my name is Shelby Hyde. I'm a registered nurse. I'm also a student at the University of Texas at Arlington in the MSN Education program. Tonight we're going to talk briefly about short-acting nitroglycerin. Short-acting nitroglycerin is a nitrate, and it's a component of optimal medical therapy for patients with ischemic heart disease. There are forms of nitroglycerin that have a long-acting effect, but today we will discuss the short-acting form. Short-acting nitroglycerin, the quick-acting forms, include tablets or oral sprays. The tablets are placed under the tongue, sublingual, or between the cheek and the gum, which is buccal. The spray is used on or under the tongue. When compared in size to other organs in the body, the heart has the highest oxygen consumption by mass. The coronary arteries provide blood flow to the atriums and the ventricles of the heart. Collateral vessels overlap to support blood supply to the heart. The coronary arteries must have good blood flow to meet the high demands of the myocardium. When they don't have good blood flow and cannot meet the oxygen demands of the myocardial tissue, myocardial ischemia occurs. The most common cause of compromised coronary circulation is coronary artery disease. Coronary artery disease is also known as atherosclerosis or ischemic heart disease. These conditions can obstruct or impede coronary blood flow, leading to ischemia and angina pain. Typical anginal pain, called angina pectoris, can include sudden, severe, crushing chest pain and may radiate to the neck, jaw, back, and arms. It's called angina pectoris. IHD is a leading cause of deaths worldwide. As mentioned previously, IHD can lead to sudden, severe, crushing chest pain that may radiate to the neck, jaw, back, and arms. Short-acting nitro reduces myocardial oxygen demand by relaxing vascular smooth muscle, dilating the large veins, which reduces preload and the work of the heart. They also dilate coronary vasculature to increase blood supply to the heart. The only drug-to-drug interactions are with PDE5 inhibitors, as these combined with nitro can cause hypotension. Effective angina relief from short-acting nitroglycerin typically occurs within 1 to 3 minutes of taking the drug. Some documentation states it may be up to 5 minutes that the patient should feel relief. If after 3 doses of nitro pain is not relieved, the patient should seek immediate medical attention. Nitroglycerin is a safe addition to optimal drug therapy for patients with stable or variant angina. Unstable angina is not relieved by short-acting nitroglycerin, and acute coronary syndrome angina is an emergent situation which requires hospitalization. Short-acting nitro is relatively inexpensive, averaging from my research $20 for 25 pills. It's also a part of a medical therapy regimen that can increase the quality of life for the patient, increase confidence in activity if used prophylactically, and can provide immediate relief of heart protection if needed during an episode brought on by activity level or emotional distress. Beta blockers decrease the heart's oxygen demand by blocking beta receptors. So we're talking about B-adrenergic blockers, and most people just call them beta blockers. Their mechanism of action results in a decrease in heart rate, contractility, cardiac output, and blood pressure. They're a relatively safe drug to take. They're contraindicated in patients taking Pendolol and patients with vasospastic angina, bradycardia, or asthma. However, patients with comorbidities such as diabetes, peripheral vascular disease, and chronic obstructive pulmonary disease are great candidates for this drug as long as they're having medical monitoring. Beta blockers are recommended as an initial anti-anginal therapy drug. The typically prescribed beta blockers such as atenolol or metoprolol are relatively inexpensive, averaging about $25 for a 30-day supply. These are great drugs to use in conjunction with a short-acting nitroglycerin. Thank you very much for watching my short video on short-acting nitroglycerin and ischemic heart disease, and are my references. Thank you.